Hi, this is Peter with Physical Therapy TV. In today's short video, we are going to discuss knee pain and specifically things that you can do to address your knee pain. Now, when it comes to knee pain, the very first thing that I want to mention to you is that you must get an accurate diagnosis. Simply without an accurate diagnosis, it's not going to be possible to really address the true cause for your knee pain because there could be a multitude of factors involved. Now, after you get an accurate diagnosis and it's made, whether it be a tendon issue, a muscle issue, or maybe meniscus or cartilage, the correct plan of treatment can be prescribed for you. Now, knee pain can be caused by trauma, it can be caused by wear and tear over time, it can be caused by muscle imbalance or overuse leading to conditions that range from tendonitis to a torn tendon, joint wear such as arthritis or a meniscus tear, or just a biomechanical issue which we see in most patients is the case, such as alignment issues where your kneecap is being irritated to either due to weak hip muscles, tight calf muscles, or a combination of that. Now here is an image of a knee displaying the muscle tendons and the ligaments and the symptoms area associated with it, where pain can present of the knee that's being affected. Now, if we look at the pain right above the kneecap, this can be caused by patellar tracking issues, bursitis, the quadriceps tendon being ruptured or irritated. If you have pain on the inside of the knee, it could indicate a collateral ligament issue or a possible meniscus tear with combined irritation and swelling and inflammation. Typically, pain behind your knee could indicate conditions such as Osgood-Schlatter's disease or arthritis with swelling. Patellar tendonitis typically presents in the below the kneecap and usually is irritated when you climb steps or you run and you extend your knee. Now, typically, patients respond very well with strength and flexibility exercises if it is a minor issue. Typical neglected muscles to strengthen when it comes to knee pain are your glutes and your hamstring muscles. And a good exercise to address those muscles would be an exercise called Good Mornings. Feel free to Google that phrase to see a live example of how to do this, because I know that there are some limitations by just looking at an image such as this. But just to run you through it, you start in an upright position. You do not need to do it with a barbell or anything on your back. And the key here is to keep your knees slightly bent, your back straight while maintaining your spine angle, and you just simply bend at the hips and just lean forward as far as you comfortably can, feeling a good stretch in your hamstring and glute muscles. It's very important though that you keep your kneecaps over your feet and that they do not glide out in front of your toes, because this will place too much tension on your patellar tendon and the knee joint itself. The second exercise that could be really helpful is to just address a tight ITB or iliotibial band. When this area or muscle or fascia area becomes very tight, it can cause some alignment issues and excessive strain on your kneecap, leading to knee pain. The iliotibial band extends from your hip all the way down to your knee, and you can Google how to do foam roll exercises, but just if you can, find a firm pillow, roll it up, or find a foam roll, and then just work your leg up and down, side to side over that. It's typically very tender and almost borderline painful, so you want to go slow, but over time, if you can do this on a daily basis, it will mold that tissue and improve the flexibility, lessening the strain on your knee. Last exercise is a hip flexor stretch or a runner stretch. You can do this in a lunge position such as this, or just a standing runner stretch where you lean against a wall, extend your one leg back, have the front leg bent, and then you should just feel a nice good stretch in the front of your hip. Those are just some basic exercises that you can do for knee pain. We do have some more information over at thepainfreeknee.com. Feel free to check it out, or just visit us at our main website, physicaltherapytv.com. If you like this video, please give us a thumbs up. It helps us on our end, and I do appreciate you watching this.